Hi, everybody. Time for our demonstration today. I talked about last week on Thursday that we were going to have a live demonstration about our microneedling treatment here at Tansavatdi Cosmetic and Reconstructive Surgery. I perform these treatments as well as my esthetician. Wanted to put a shout out back to Bond and Avant for putting up a editorial piece. They interviewed me about a week ago about the microneedling treatment, and we had this on the schedule at the same time. It kind of worked out perfectly, but we were planning on doing this already for a live demonstration, so this kind of works out together. You can read that piece on bondandavant.com and also check out their social media channels. So what we're going to do today is the device I use is called the Bellus Skin Pen. And there are some other devices out there, but I'm going to demonstrate what we use here in our office. There's other things that you can add to the treatment, including PRP, which is using your own platelet-rich plasma. You have to draw some blood. Some people call that the vampire facial. Vampire facial is a little bit different, really, but taking your PRP, some blood, and splitting that and just isolating the plasma, which has stem cells in it, to help regenerate for wound healing, to speed up wound healing, as well as to improve the wound healing so that the texture of the skin is better. There's more collagen formation. So I did put on a little microphone today that's not on the YouTube, but it is on Periscope. So we'll have this video later, and for audio purposes, I wanted to do that because the video might be away from the demonstration that I'm doing. All right, so now we're gonna go over to the other room. I've prepped a patient. Her skin has been cleaned. I usually use numbing cream because this procedure does break the skin, and it does go to about 1 to 2 millimeters depth. We're trying to get into the dermis to stimulate collagen, and the dermis is where there's a lot of good blood vessels to the skin. So you'll see some bleeding if you are if blood is something that you're not very good at seeing on TV, then tune away for that. Turn around. Don't look at the video when we're doing the procedure, but you could also just take a listen to us on the audio and just kind of block off the video portion. All right, so with further ado, we're gonna go to the other room, and the numbing cream usually I leave on for half an hour, and then we take that off, we clean the skin again, and everything's ready for our patient over in another room. So we're gonna go over there right now. All right, so after I take off the numbing cream, I like to start on the forehead first because that's the most sensitive. That's the most sensitive for me, so I'm going to do that for her as well. Do you mind if I mention your first name? Is that okay? Sure. Okay. Lisa, I'm going to be talking to you as if you're my patient here. So I know that they're on camera, but Lisa, I'm going to start off with the forehead. And so this procedure is good for fine lines and wrinkles. It is not for hyperpigmentation. Okay, that's a can you deliver products for the hyperpigmentation? You can, because once you've had open channels to the skin, you can deliver vitamin C if you wanted to. But we're not going to do that because once those channels are open, it's kind of sensitive, skin sensitive, and we don't. Oh, before I start, you already heard the noise, but that's the noise that's being delivered by the pen here. So if you could see close up, this is the pen. These are the needles. You can see on the end here, the needles there, and it's in a chamber. And this is all sterile. This is not reused on other patients. We toss this at the end. Now when I push the button, you'll see it goes in and out, in and out. And this is going 1,000 times a minute. So it's actually puncturing the skin many times, and there's 12 needles in here. So you imagine 12 times 1,000, how many pokes are we putting in the skin? It's good because of that, though. It sounds like a lot, huh? Okay, we're gonna start off with the forehead. I don't wanna have her wait too long because the numbing has been off. But my goal to start here first is just put some saline here so I can glide. And the pen, I'm going to glide back and forth so that we can cause all those traumas. I passed through the area several times. Right, before we start, let me just make sure the depth, because the depth is not exactly where I want it. We're going to start off at 1 for her forehead because I don't want to get her too sensitive on this portion. The forehead skin is not as thick, doesn't need to be put in as thick on the pen. Okay, here we go. First start off, how are you doing, Lisa?
Good.
Any pain?
No.
Okay. I think she had some concerns. I've seen her wrinkle her. You were frowning.
I did.
Right?
From the beginning.
Yeah, I saw that. Now the edges might feel a little sensitive, and that's when we get into the cheeks. I'll let you know we're getting there, and that's. Now I do want to see some red response, which we're getting. Relax your muscles. I'm trying to get a flat surface here. You can come closer if you need to. So I've done this pass, now I'm going to do a second pass, but I'm going to use some sand so I can glide here easier. You're seeing some pinpoint bleeding now. I'm trying to get a smooth surface. I know I'm pushing on your brows a little bit, Lisa, but that will make it so that, because I think you're raising your brows a little bit. It's okay. Okay. I like to take care of these glabella lines. So we're going to pass a couple times here too. Okay. Yeah, we're going to get through this area one more time. Okay. I don't want to overlap too much, but I do want a little overlap. This is kind of similar to what I would do for laser resurfacing. I do a little bit of overlap. And I'm putting a little bit of pressure. How's the pain?
It's actually okay.
Yeah?
I mean, it's not,
It's not without pain.
No, it's not.
But it's not like.
It sounds worse than it is. You know what I mean?
There you have it. Patient saying it's quite comfortable. Not completely comfortable, but she knows that something's being done. Right?
Mm-hmm.
Taking care of these forehead lines.
Right.
Now you guys are going to see a little bit more redness as I move through the rest of the face. I don't do it too deeply on the forehead because it is sensitive. It is sensitive for me. Okay, so we've done the forehead. Let me just turn that down so people can hear me. Can you hear me? Can you hear me? Are you okay? All right. Are there any questions out there? Did you see any? Because I can't see the screen.
No questions.
Okay. I'm going to switch now a little bit more on the cheek area. Okay? We're going to go on the side of the face. I want to go to the areas that are going to be the sensitive spots first before the numbing cream wears off. Okay. Not like I'm on this side. I can see this a little bit better. I know, the sound sounds pretty bad, huh? You're like, oh my God, what's going on there? How are you doing here?
Good.
You've got tough skin.
Really?
Yeah, I'm not seeing much redness or bleeding, so I might have to dial this up a little bit. I do want a little bit of bleeding.
Okay.
When I do dermabrasion or CO2 laser, we want to get into a little bit of that bleeding because that's where, you know, that you're getting at least into the papillary dermis. That's where the collagen is being formed. Okay, so we're going to go up. It's okay. A little bit of redness, but not much bleeding, so. And I'm just going to go back and forth in different rows. Okay, so a little bit of pinpoint bleeding there. Okay, you're doing pretty good there. Let me do one more pass. No, we usually do about 2 passes, but I'm looking for actually the end goal of some redness and a little bit of pinpoint bleeding. Okay, good. That was the side. And now we're going to do a little of the cheeks here. You guys you got nice full cheeks. Makes it round and kind of a slide over. So ideally, you want to do this if you're treating fine lines and wrinkles. You probably want to do this once a month for 6 treatments, and then do a maintenance. Probably recommend like 2 to 3 times a year. Just really stimulate that collagen and get the skin to tighten and keep tightening, because as we get older, we lose collagen. And even though you've done treatments to stimulate the collagen, it's not long-term, not because it hasn't worked, it's that you need to continue to stimulate collagen because your body just heats it up. And
Good question, is this for anti-wrinkling?
Yes, it is. That's a good question. This is a surface treatment that is great for anti-wrinkling. It is a little invasive, so it's not, it breaks the skin. So you can see at the end now, it's been a little bit of blood, okay? Now again, this is tossed at the end. It's all sterile. Comes in a sterile packaging, so you know we're not passing along any blood from patient to patient. This is not clean. It's just used one time.
Where are we located?
So what we're doing to treat anti-wrinkling is we are getting down into the dermis. We're making little pokes in the skin, and our goal is to wound the skin. Anytime you've got some incision in the skin, a cut, it stimulates collagen. And that's what our primary goal is, to tighten the skin by introducing new collagen, and that tightens and eliminates those lines. Okay.
How much does it cost?
You're getting a little sensitive?
No.
No? Okay.
The question was, how much does it cost?
The procedure, it just depends on what we're adding to the procedure. If we're just doing the procedure itself, a typical treatment will run anywhere from $300 to $600 to $900, depending on who's doing the treatment. If you have a physician doing the treatment, of course, the treatment's going to be a lot more expensive. Also, what other factors play a role is if we do additional treatments on top of that. So like I said earlier, we could do PRP, which is also known as the vampire facial. Some people would term it that. And that's taking your blood, spinning it. So you got to collect blood. And so we're getting a concentrated stem cell serum that we apply over the face in all these areas that we've just treated with these needles. These needles are breaking the skin and creating tiny holes that you can't see at the surface, but they're creating many holes. Again, there's 12 needles on this end, and it's going in and out 1,000 times a minute. So imagine how many holes we're creating. So it leaves a channel for us to then insert the stem cells deeper into the skin, because anything you apply topically is not going to quite get there. Okay. You know how you put your lips together? Yeah, perfect with that. That's what you were doing. No, together? Yeah, in, yeah, perfect. Okay. How are you doing, Dad? You feel like a little sensitive? I can turn that down. This does get a little sensitive in that spot. I can see that you turned a little bit more red. So we're going to go down on that. Go back to 1 for this area, okay? So, but your chin, you had a little bit of dimpling and stuff, and that will help with that, as well as the fine lines. So now on the upper lip, You doing okay with this? Is this
Mhm.
better than the?
Alright.
Okay, good. So I turned it down for her comfort, but also because you could see she was getting some bleeding here. You see that, right? That's more than she was getting other areas. Open up now. Okay, there we go. I'm gonna get the corners of the mouth. This is a typical area where people get folds and lines. The corner of the mouth. I'm gonna do that as well over here. I know it's sensitive.
Thank you.
They
Those are tricky areas.
are tricky areas. Yep. How have you been doing for this whole treatment?
Good. I'm really surprised. It's because I was a little nervous, and
Yeah.
it is.
I'm gonna leave the nose for last. Okay, that's an area that's not as smooth and harder to like get over and around. So, okay. So we're gonna stop the video here. You can see half of the face, quite red. She's got a little bleeding here. She had pinpoint bleeding in the cheek, chin, and the forehead too as well, but not as severe as the upper lip, which we turned down because I don't want to get that much bleeding. Now we can turn up the treatments further down the road if the patient's tolerating it well. She'll have a little bit of sloughing of the skin. You should expect the skin to peel maybe the second or third day. The redness that you see here is beet red here today, and this redness is going to die down by about half tomorrow, and then the following day, on the second day, that redness is gone. So this is something you can cover with makeup tomorrow, but not the day of the procedure. All right, because the channels are still open, and so we don't want to get all the pores all clogged up. All right, there you have it. This is the microneedling treatment. Check us out at facesbydrt.com. That's my website. Also, check out our social media channels. Leave a comment if you have questions, and come in for a consultation to meet me and my esthetician, Anna, so you can have this treatment done. It's great for the summer. If you have some problems with pigmentation, you can still have this done. It's not going to be a treatment that's going to affect your skin like chemical peels would during the summertime. All right, tune in next Tuesday when we have our next video. Thanks for tuning in. Bye.